Welcome back to MedBites. Let's go over the course of the ureter, one of those important things that everyone thinks they know until they mix it up. Just a quick heads up, the full version of this video that includes a practice question at the end is on YouTube. Unfortunately, due to time constraints on TikTok and Instagram, I can only show you guys the explanation part. So if you want a practice question to test your knowledge, go to YouTube, link in bio. All right, let's get to work. Now, the ureter starts at the renal pelvis, right here, and travels down on top of the psoas major muscle, and from here it hits three high-yield relationships. So let's go over what we are seeing. So here's the aorta. This first vessel is going to be the gonadal vessels. Gonadal vessels. And then here we got the common iliac artery. Now, the ureter first crosses under the gonadal vessels. It's important that you guys know this. It goes under the gonadal vessels, and then when it reaches the pelvic brim, it crosses over the common iliac artery. So right here, right? It goes over the common iliac. It's important for you guys to know that this is the only part where the ureter goes over anything. That's it. You just remember this fact, and you can basically remember that the rest of it would be under. And then the third part, which is inside the pelvis, it returns to its original classic pattern. So in females, it's going to be the uterine artery, and in males, it passes under the vas deferens. This is extremely high yield for OBGYN, especially the uterine artery part. So let's go over a question. A 42-year-old woman, G0P0, comes to the clinic with right-sided pelvic discomfort that has gradually intensified over the past 2 months. The pain is constant and does not change with her menstrual periods. She also notes progressive abdominal enlargement despite a reduced appetite. Pelvic examination reveals a fixed, irregular mass in the right adnexal region. She is scheduled for surgery, during which a large ovarian tumor is encountered. During the procedure, while examining the structures within the true pelvis, the surgeon would most likely find the right ureter passing directly beneath which of the following structures? So I'll give you guys 5 seconds to answer this. All right. The answer would be the uterine artery. So we said, as we go up here, we said that this part is going to be in the abdomen. This is the pelvic brim, and here is going to be the actual pelvis. And we said that the only place that the ureter goes over is the common iliac. Everywhere else, it's going to be under. Up here, it's going to be the gonadal arteries, and in the pelvis, it's going to be the uterine artery, or if this patient was a male, it would be the vas deferens. And there's that. Good luck.